Hello everybody and welcome in our short therapeutic videos. We continue in medication used to treat cough. Today we'll discuss productive cough. Treatment of productive cough could be by mucolytic, a medication that decreases mucus viscosity by breakdown without an increase in mucus amount. And we have three main types in this group: bromohexine and its metabolite amproxol, acetylcysteine, which is used commonly in treatment of COPD and cystic fibrosis. The second group is expectorant, a medication that decreases mucus viscosity by increasing body secretion in mucus itself. It includes guaifenesin, a commonly used expectorant with a side effect include nausea, headache, and altered mental status with a high dose. Also, we have potassium iodide, ammonium salt, and sodium salt. We could choose bromohexine and amproxol for most of cases, except in gastritis. It could affect the gastric mucosa. We could choose guaifenesin. Antihistamine decrease mucus in productive cough and decrease irritation in dry cough and could be used in both. Other important helpful advice for the patient: adequate hydration. Honey, likely to be as or more effective than dextromethorphan at improving cough in children, but should not be used for children below 1 year because of the risk of botulism. 2 to 5 years could receive half teaspoon, below 12 1 teaspoon, and above 12 2 teaspoons. Humidifier and water vapor have a dual effect in dry and productive cough.